Preventive measures and anesthesia before treatment. The face ages as a result of various phenomena. Thinning and loss of the skin's elasticity, reduction and ptosis of the fatty tissues, and changes in muscle tonicity must be taken into account through an overall aesthetic diagnosis and approach. Radiesse injections thus fill in wrinkles, replenish volume, redefine facial contours depending on the indications for the patient. A static and dynamic anatomical analysis is essential for obtaining optimal aesthetic results. The priority is to preserve the natural originality and expressions of each face. Throughout this Radiesse injection demonstration, an anatomical explanation will be correlated to the aging symptom being treated. The Radiesse treatment plan must be explained by the practitioner and agreed by the patient. Certain recommendations are important to respect, as with any filler injection. A complete questionnaire and thorough clinical exam of the area for the injection will allow for the detection of contraindications, whether anti-inflammatories or anticoagulants are taken, or areas that require specific precautions. It is recommended to photograph the patient before the injection and adapt anesthesia to the patient if necessary, local, truncular, as well as to note the doses of the products injected. Anesthesia. Anesthesia means better comfort for the patient and, in turn, the practitioner. Several options can be proposed, especially if the area to be injected is sensitive or several indications are contemplated. Topical anesthesia. Application of a eutectic mixture of local anesthetics which effectively penetrates intact skin. Local anesthetic. Several local anesthetics are currently available. Local infiltration is carried out by a very fine needle and the injection is done slowly. Effective in small quantities, this option should not be used in excessive volumes to reduce tissue distortion. Regional anesthesia is effective anesthesia with low tissue distortion and covering a large zone. The truncal technique must be precise, injecting a small dose of anesthetic directly on the nerve trunk concerned and not on one of its branches. Applying ice is also an easy and safe method of reducing pain. An ice pack wrapped in a towel is applied 2 minutes before the injection without overexposing the skin to cold to prevent burning. These ice packs are also applied at the end of care to reduce edema and hematoma. Marking the face and safety lines. Mark the suborbital limit. If the level on the opposite side is different, lower the upper limit line so that it lines up with the lowest limit. Mark the suborbital foramen. Use a cotton swab to find the subtle depression under the skin. The patient must report any nerve irritation. Trace the line of the medial canthus tendon parallel to the patient's nasolabial fold. The injected product must remain lateral to this line. Mark the lower limit of the cheekbone by tracing a line from the perialar triangle to the tragus. General rule to respect: above this line, administer an injection into the deep dermis and hypodermis and/or an upper periosteal bolus injection and an upper periosteal and subcutaneous injection to improve the lateral zygoma area in order to connect the areas around it. Below this line, inject into the deep dermis and hypodermis only. Mark the limits of the zygomatic arch. These lines are very important in that the first insertion point must be at the middle of the zygomatic arch.